Right, it's already 3:02. A very warm welcome to our guest speaker for today and also our attendees that have joining us today on this beautiful, hot, sunny Sunday afternoon. Thank you for joining us on our 31st episode. This month marked the almost 2 years since we started the Virtual Health Talk back in April 2020 when the whole pandemic started. So without further much delay, I would like to introduce our speaker for today. And I'm going to read out a very short biodata on his side and have him to introduce himself before he starts sharing. Okay, if you have any questions for our speaker for today, please post them in your chat box because everyone is muted. You are not allowed to unmute yourself to ensure that we don't have any interruption during today's sharing. Okay, so today our speaker for today, his name is Dr. Ramesh Maniam. Welcome and thank you for coming to our talk today. He is the head of the Health Screening Center of Gleneagles Hospital, Kuala Lumpur. Dr. Ramesh Maniam has joined Gleneagles Hospital, Kuala Lumpur as an occupational health doctor in 2014. Prior to that, he worked as a service registrar at emergency department at Hospital Tengku Ampuan, Rahimah for more than 3 years. So without further delay, I would like to pass the floor to Dr. Ramesh to start his sharing now. Thank you, Doctor.
Okay, thank you, Amy, for the introduction, and good afternoon, everyone. Okay, it's a Sunday afternoon, so I think everyone is at home, and yeah, I hope this will be a very interactive session, right? And on top of the introduction by Amy, just to inform, I'm heading the Health Screening Center. So in our center, we are running the health screening program, wellness program, as well as adult vaccinations. When I say adult vaccinations, that includes, is everyone clear? Can hear? Okay. All right, so that includes flu vaccinations, pneumococcal, yellow fever, travel vaccinations, and so on. And last year, in June, we have started the PPV for COVID vaccinations, and I've been also heading that services, which we have recently closed. We have stopped the national immunization program in our hospital. However, we are still doing the Sinovac vaccination, which is a paid private vaccination. Okay. So today I'm going to talk about the COVID-19 vaccination, and I will focus on the adult booster dose vaccination as well as kids primary series vaccination. Okay, and the presentation will cover details on the current data, which is available in Malaysia now, and the booster dose vaccination for adults, primary series vaccination for kids between 5 years to 11 years old, which has been recently started in Malaysia. And I'll touch a bit on the serious topic of discussion currently, which is incidences of myocarditis and pericarditis. And yeah, we can move forward. Next slide, please. Next slide. Okay. The earlier slide, please. Okay. So this is actually what we can see. All of us can access to this data from the covidnow.moh.my, right? covidnow.moh.my. We can get the latest updates as well as statistics on vaccinations, infections, death rates, and so on. So I would like to explain a little bit on the COVID-19 vaccination data. Starting from last year till now, we have vaccinated up to about 68 million people plus 68,455,000 plus people. And out of it, 15,465,855 boosters. This is data up till yesterday. So that shows that many people have taken the boosters in Malaysia. However, our minister have just announced that another 35% of the population has not gone for the booster. So I hope with this presentation, some of you who might not have taken the booster will consider for the booster. Okay, next slide, please. Okay, and this is the vaccination progress by state. Overall, in Malaysia, 79% of people have taken at least one dose of vaccine, right? And as we can see, the data seems to be encouraging in Klang Valley, okay, 94.9%. However, slightly lower in other states, right? Next slide. All right. And this is the data for children between 5 to 11 years old. So still very low. We have just started it recently. 35.3% of kids between 5 years to 11 years have been vaccinated. They have received the first dose of vaccination as of now, right? So it is still a challenge. We have got to vaccinate at least another 35% to reach the 70% of target, right? Next slide. And this is the breakdown based on the type of vaccines, right? So overall, about 60.2% of vaccines, those vaccinated as opted for the Pfizer vaccine. Another 31.2% of population being vaccinated with Sinovac. The rest of it, like AstraZeneca and CanSino, accounts for less than 9% of the total types of vaccine which have been administered in Malaysia. Next slide. All right. Okay, so we have seen the data. That's just an introduction for all of us to understand what is the current situation in Malaysia, what is the vaccine uptake, which as of now seems to be encouraging. However, we may need to close some gaps, especially for booster dose vaccination as well as for kids vaccination. Okay, let's focus a bit more on the booster dose for adults. Next slide. Okay, my presentation will be more of a Q&A type of presentation, so it's a bit more clear. So a very common question, why do we first of all need a booster dose? We have taken the first dose and second dose of vaccination. Wouldn't that be sufficient? Based on studies, the effect or the efficacy of the vaccine seems to be waning over a period of 3 to 6 months after the second dose, which is why we strongly recommend the public to take the booster dose to enhance the immunity, to enhance the protection. And who should get the booster, right? As of now in Malaysia, only those above 18 years old are allowed to take booster dose vaccination. So we have been getting a lot of inquiries for adolescents between 12 years to 17 years for booster dose. As of now in Malaysia, as per Malaysian guideline, it's not allowed. However, yes, there are certain countries, US or in UK or even in Singapore, booster dose vaccination for adolescents has been started. So we look forward for the booster dose vaccination for below 18, probably in a few months' time. And the priority group for booster dose, of course, the frontliners, elderly patients or elderly people, those with underlying disease or comorbidities, such as diabetes, hypertension, bronchial asthma, history of pneumonia, and so on. Pregnant women between 12 weeks to 33 weeks of pregnancy, and travelers, especially for those who are going for Hajj or Umrah or to countries with high incidences of COVID-19. Right. Next slide, please. Okay. So as we know in Malaysia, for now, a lot of vaccines have been approved for booster dose vaccination. Okay. Sorry. Right. May I check if it's clear now?
Doctor, is clear.
Doctor, is clear.
All right. Okay, I'll proceed. Okay. So the vaccines which have been recommended by our Ministry of Health is, of course, the Comirnaty or Pfizer vaccine. That's due to the data showing it has a better efficacy when given as a booster dose. However, AstraZeneca or Sinovac vaccines can also be taken as a booster for those who are contraindicated to take the Pfizer vaccine. Okay. For those who have taken the first dose or second dose of Pfizer previously, the recommended vaccines are Pfizer or AstraZeneca. For those who have taken AstraZeneca as primary dose, they may opt for AstraZeneca or Pfizer vaccine as a booster. And people who have taken the Sinovac vaccine, they may go for the Sinovac, AstraZeneca, or Pfizer vaccines for, for the booster vaccination. And the interval has been standardized, which is 3 months after the second dose of vaccination, except for the Johnson & Johnson vaccine, which is it is advisable for people to take 2 months after the first dose. However, in Malaysia, as we know, the most common vaccines are the Pfizer, followed by Sinovac and the AstraZeneca. And many people are concerned because they have taken the primary series, which means they have taken the first dose and second dose. However, they have been infected with COVID. We see hesitancy among people on whether they can go for the booster after being infected with COVID-19. If yes, how soon they can go for the vaccine. So as per the current guideline in Malaysia, yes, those who have been infected with COVID-19 after the first and second dose, they are advisable, they are recommended to go for the booster dose, and they can be vaccinated soon after recovery, which means soon after they are out of the quarantine period, they may go for the booster dose vaccination. Next slide. Okay. So we also have people who are hesitant because they believe that the booster dose does not work against Omicron. Based on studies, especially a study recently conducted by the Pfizer BioNTech, it states that booster dose increases neutralizing antibodies up till about 37-fold higher, which means, yes, booster dose does help with Omicron. There have been studies, data showing that in countries where booster dose has been administered, the incidences of Omicron vaccine infection has been rather lower as compared to other countries. And which is better? Should we go for the same vaccine as per the primary series, or should we go for a combination, right? So as per data, for those who have taken first dose and second dose of Pfizer, it is highly recommended to take Pfizer as their booster dose as well. It seems to have reduced risk of infection up till about 62%. For people who have taken AstraZeneca or Sinovac, again, it is very helpful. It's highly recommended to go for Pfizer as the vaccine of choice for booster. However, people who have been contraindicated from taking the booster dose, yes, they may consider either taking AstraZeneca or Sinovac due to their contraindication of taking the Pfizer vaccine, right? Regardless, those who have taken 2 doses of Sinovac and opting to take the booster dose of Sinovac, it seems to have increased the vaccine efficacy up till about 74%, which is still good rather than nothing, which means it is highly recommended for people to go for booster dose, even if you do not want to take the Pfizer or if you are contraindicated from taking the Pfizer dose vaccine. Next slide, please. Nowadays, we have these emerging questions. Do I need the 4th dose? Because there have been news, there have been a lot of articles on the 4th dose of vaccine. There have been recommendation of taking the 4th dose 6 months after the 3rd dose of booster. The studies are still going on. However, a recent data, which was released in February 2020, last month, it shows that the booster dose effectiveness wanes after 4 months. Okay, this has been conducted in the United States. It shows that after the booster dose, the effectiveness of vaccine seems to be 87%, against the Omicron, but it has reduced to up till 66% after 4 months. So there are many people being infected with Omicron 4 months after booster dose. This probably leads to a suggestion, a recommendation that a fourth dose of booster might be required. However, we will wait for the guideline from Ministry of Health. Okay, so as of now, the answer is no, not in Malaysia. We are still waiting for a guideline from Ministry of Health. Next slide. Okay, so will I get any side effects after booster? The answer is yes, right? So it is similar to the first and second dose. Most of us develop pain, redness, or swelling at the injection site. In fact, on a personal experience, I felt more pain after the booster dose on my arm, and there were similar incidences among many booster dose vaccinees. So that doesn't mean we should not take the vaccine. These are very common with vaccinations. In fact, fever seems to be common. People have headache or muscle pain, joint pain, tiredness, and we have also seen vaccinees coming back with lymph node swelling over the neck or the arms or the axilla, which is more commonly seen among young female. So do not be worried about all these side effects. These are common, and there is a common saying which is no pain, no gain. So we need to go through such side effects, which are usually temporary. However, if the fever persists more than 48 days, or the side effects does not seems to be reducing over a period of 48 hours, if we have respiratory symptoms such as cough, runny nose, sore throat after the vaccination, especially loss of sense, loss of taste, loss of smell, which can be related to COVID infection, or other more significant side effects like chest pain, shortness of breath, abnormal heartbeats. In such situation, we should not wait. We should go to the hospital or clinic for immediate attention by a doctor. Right? This could be signs of even myocarditis or pericarditis, which I will explain later. Okay, very rarely, but we may develop severe allergic reaction to vaccinations. So it is important for all of us to understand what are the signs of allergic reaction. For example, breathing difficulty, swelling over the face, eyes or lips, a very fast heartbeat, we may have palpitations, dizziness or weakness, which are very significant. We may even faint, or we may develop syncopal attacks, rashes all over the body. These are signs of allergic reaction or severe allergic reaction. So we should go to the hospital immediately after after we notice such side effects. Next slide. Okay. So what should I do before and after vaccination, right? Okay, so before the booster dose, make sure you get enough sleep. Okay, prepare yourself, have a healthy diet. Make sure you take breakfast or lunch before before going to the vaccine center, right? We do not have to fast for the vaccination. Okay, in fact, we have seen vaccinations coming to the center claiming that they have not eaten for the last 10 to 12 hours, which is not required, right? Wear an appropriate clothing. Okay, it's recommended to wear a t-shirt so it's easy to jab on the arm, right? Okay, not to forget the protection, wear the face mask, if possible, wear a face shield before going to the PPV, right? Bring a vaccination card as a proof of the first and second dose. Even though, yes, we have the MySejahtera app, in case of any issues with the system, yeah, so we still have to show the proof of vaccination, the vaccination card, okay? And ensure that you are not in quarantine. If you are infected with COVID and you have received a message to quarantine, please do not go for vaccination. Similarly, if you are a close contact with someone having COVID, please defer the COVID-19 vaccination till you are free from the quarantine, right? And after the vaccination, we have to observe. We will be observed at the PPV for about 15 minutes, similar to the first and second dose, and make sure that we still follow all the COVID-19 prevention measures, such as wearing the mask, face shield, hand hygiene, and so on. Keep the vaccination card in case of a failure with the MySejahtera system, or in case we lost the phone, right? We still have the vaccination card with us, right? And most importantly, avoid any strenuous activities. Avoid any heavy exercise. Avoid carrying heavy items for at least 1 week. But generally, we tell patients for at least 2 to 4 weeks, avoid heavy activities. Avoid playing futsal or going for a sports activity, right? This is highly recommended. Please be careful after taking vaccines. Next slide. Okay. So now let's move on with the primary series for kids. Okay. So the age group as of now, 5 to 11 years old for the kids vaccination. This has been initiated since February. And the priority is given to those with underlying medical illness, diabetes, respiratory illness like asthma, children with neurological problem, children with kidney disease. I'm sorry, just a minute. So sorry, I'm just running out of battery. Okay, I put it on charge. Okay. So children with chronic kidney disease. So this is the priority group. So why do we prioritize children with such condition? Because if these children get infected with COVID-19, they may develop very serious complications. Therefore, we give priority to those children. And moving on, of course, we need other children who are considered healthy kids to also go for the vaccinations. Now that the schools are starting tomorrow, so the expectation from Ministry of Health is at least 50% of kids should be vaccinated with at least one dose of COVID vaccine, right? And the types of vaccines can be given to kids. Pfizer has been the first vaccine approved, and last week Sinovac has also been, 2 weeks ago, Sinovac has also been approved to be given as a kids vaccine, right? Especially for children who have any form of any sort of contraindications towards Pfizer, or if the parents are not keen to go for Pfizer, they may opt for Sinovac. In all the kids PPVs, currently they ensure that both types of vaccines are available. So if the parents are worried or afraid of taking the Pfizer vaccines, they can go for the Sinovac. Right? And the interval between two doses, as of now for Pfizer vaccine, for children, between the first dose and second dose, the interval is 8 weeks. And for Sinovac, it's 4 weeks. So we can see it's rather longer as compared to the adolescents or adults. Okay. The reason being, there have been data showing that with longer interval, the immune response may be stronger. The vaccine effectiveness may be higher. Okay. Potentially longer duration of protection. And also, it seems to be reducing risk of myocarditis or pericarditis following the second dose of the vaccine. So therefore, it's recommended to follow the interval which has been suggested. And for children, and this data came from studies conducted among adults. However, for children, as of now, there is no studies have been conducted on the extended dosing. So we will still follow this interval, and it may change with further data. Next slide. Okay. So what are the dosage? Okay, we need to have an understanding, right? So when we bring our kids to the PPV, we need to have some basic knowledge on the dosage of the vaccine being administered. Okay, first of all, looking at the table below, you can see that the while between for adult the Pfizer for the 12 years and above and also for kids are different, right? You can see the color of the cap itself is different. It's orange in color, and the dosage is also different. For adult dosage or for adolescents above 12 years, we give them 30 microgram for each dose. Whereas for the kids, we give them 10 microgram. And for one vial of the kids vaccine, it can be diluted to be administered for 10 children, which means one vial contains 10 doses, and each dose of the Pfizer vaccine is 0.2 ml for kids. So if we remember clearly, for those of us who have taken Pfizer previously, we were given 0.3 ml. For children, it should be 0.2 ml, and it is only 10 microgram, which is much lower as compared to the adult or adolescent dosage. However, for Sinovac, for those of you who have taken Sinovac, if you remember, the dosage is 0.5 ml. And for kids 5 to 11, it is the same. Okay, so there is no change in terms of the dosage for Sinovac for kids, adolescents, as well as adults. It is the same, which is 0.5 ml. And yes, we require 2 doses of Sinovac between 4 weeks and 2 doses of Pfizer between in the interval of 8 weeks. Next slide. Okay. So very common question as parents, as a father myself. Okay, we have worries on the safety of the vaccines for the kids. Okay, is it clear? Okay, so based on some of the clinical trials conducted, right, about 2,268 children were taken into account for the trial. The vaccine seems to be safe and well tolerated. There have been side effects like pain, fatigue, or headache, which has quickly resolved. However, no serious reactions or myocarditis seen. Okay, and real world data, more than 8 million doses have been given to kids between 5 to 11 years old, and that again supports the safety of the vaccine, right? And vaccine efficacy was also excellent. Okay, for children who have been vaccinated, it shows 90.7% of protection from symptomatic COVID-19, which means children who have been vaccinated and developed COVID-19, 90.7% of them did not have symptoms of COVID. That means they had a very mild type of infection. Next slide. So, what are the contraindications? Generally, yes, severe allergic reactions to vaccine ingredients or any previous vaccination. If let's say the child have been given childhood immunization and developed severe allergic reaction, they may be contraindicated, so require a consultation by the doctor in charge. And also for children who have developed allergic reactions after the first dose or second dose, they will be considered contraindicated to take the similar type of vaccine. For example, if a kid has developed allergic reactions after getting Pfizer first dose, we may consider giving them or restarting another cycle of vaccination with Sinovac, right? Next slide. So as I've mentioned, the common side effects, this is again another study among kids. So it's about 70% over pain at injection site, which is also similar to adults with some local reaction with such as redness and swelling. Systemic reactions, which are again not too serious, such as fatigue, weakness, about 39%, headache, muscle pain, and chills. These are the common side effects seen among kids over a study conducted within 7 days from the first dose of vaccination. Next slide. Again, this is for kids who have been vaccinated with Pfizer, okay, based on data in December last year. Okay, again, out of about 4,000 studies or samples, 1,183 no adverse events, and the rest of them they developed uh, side effects such as vomiting, fever, headache, and some of them had symptoms of syncope, which are considered or fainting, which are considered as a reaction toward due to fear. Okay, there are many kids having what we call as vasovagal syncopal attack. That means due to the fear to the needle, they may have a very short episode of fainting, which will recover within minutes, right? So this is also commonly seen, which is also why we need to ensure the kids are observed at least 15 minutes to 30 minutes in at the PPV, right? Next slide. Okay. So what about kids who have been infected with COVID-19? Okay, can they be vaccinated? Yes, but with precautions, right? For children who have been vaccinated with COVID-19 and developed multi-system inflammatory syndrome, okay, which I will explain in the next slide. So children with multi-system inflammatory syndrome, which we call as MISC, they may have to defer the vaccine for up till about 90 days after recovery. Okay, this is considered as a very serious complication due to COVID infection. So we may have to defer their vaccination. However, children who have been vaccinated without serious complications such as MISC, they may uh, be vaccinated soon after recovery, which means soon after they have been considered free from quarantine. Right? Next slide. Okay, so this is what we mean by multi-system inflammatory syndrome in children. Okay, this is a severe case of severe reaction after any form of infection, especially seen among kids, right? And also adolescents. This syndrome occurs within about 2 to 6 weeks after the initial infection. Okay, but it's not too common. About 1 in 3,000 cases, and usually require ICU admission. Okay, and among this group who have been admitted to ICU, 1 to 2% may uh, uh, may may lead to mortality or death, right? So again, this shows why it is very important to vaccinate kids, because kids may tend to develop severe form of COVID-19 infection if they are not vaccinated. Next slide. So now comes the biggest worry among parents on incidences of myocarditis and pericarditis. Okay, especially after the Pfizer vaccine. Okay, based on studies, the uh, incidence of myocarditis and pericarditis, sorry, okay, excuse me. Okay, the incidence of myocarditis and pericarditis seems to be rare, and it usually happens among young individuals, male after the second dose. Okay, and the symptoms such as difficulty breathing, chest pain, palpitation, or fainting seems to be common with symptoms of myocarditis, with incidence of myocarditis or pericarditis. However, most of the time it's mild, and they respond very well to the medications. Okay. However, the mechanism of development of myocarditis or pericarditis still uncertain. Okay, what we mean by myocarditis or pericarditis is the inflammation of the heart muscles. Okay, that's what we mean by myocarditis or pericarditis. Among children between 5 to 11 years old, it is still unknown. Okay, we have no uh, sufficient data of such occurrence. However, it is expected to be very low, right? And similarly, overall, the adverse events due to Pfizer vaccine seems to be substantially lower among children 5 to 11 years old, even compared to adolescents 12 to 17. Next slide. So based on data from Pfizer BioNTech, so there have been about 12 cases of myocarditis reported out of 8 million over doses administered, right? So it's a very, very low number as compared to the total number of doses given. And out of it, it seems the median age, that means the common age group who has developed it, 9 to 11, and it happens about 2 to 3 days after the vaccination. However, all of them have been discharged and recovered from the symptoms quickly, and none of them have been reported to have a vaccination error. That means they have not been given overdosage of vaccine or anything like that. So the number seems to be very, very low, 12 out of over about 8,674,000. Right? Next slide. Okay. Again, this is reporting rates of myocarditis per 1 million dose administered. Okay. Between 5 to 11 years old, this is another study, up till about 37 million vaccines have been administered to kids, adolescents, and adults. And based on this number, the number of myocarditis after the first dose between 5 to 11 years was 0. Okay, there were no incidents of myocarditis among 5 to 11 years after the first dose. However, after the second dose, there was about 4.3 out of 37 million, right? So that is a very, very small number of myocarditis. However, we can see the incidences are a bit more higher among young adults and adolescents. So 12 to 17 years old, there were more incidences of myocarditis as compared to kids. Okay, next slide. Okay. So for parents who are very worried about myocarditis and pericarditis and also other forms of side effects, first of all, we should ensure that our children are not involved with any rigorous or strenuous exercise for at least 1 week. Okay, to be safe, I would say at least for the next 2 weeks after the vaccination, please uh, refrain kids from doing any form of heavy exercise. Yes, they may go for schools if they don't have any symptoms. However, it's important to inform the teachers that they should not be allowed for rigorous exercise, right? And if they develop any form of symptoms, okay, bring them to the nearest clinic or hospital as soon as possible, okay, and ensure that the doctors or the healthcare workers are informed that the kid has received the COVID-19 vaccine recently. Okay, and usually the doctors will examine and do further tests to determine whether this is caused by the vaccine side effects. Next slide. Okay, so again, it's very important for parents to know what are the side effects of myocarditis and pericarditis. So most commonly, chest pain. Okay, if the kid or the adolescent complain of chest pain, difficulty breathing, breathlessness, palpitations, which means feeling of having a fast heartbeat or pounding heartbeat, or if you notice the child has a fainting episode, please bring to the hospital immediately. This could be a sign of myocarditis or pericarditis, which, as per the data I've shown earlier, can be recovered with immediate treatment or attention. Next slide. Okay, so we have come to the end of the presentation. So as a conclusion, I would say that booster vaccination for adults and primary series vaccination for kids are recommended. It will help to reduce the COVID-19 infections as well as the complication among those who are infected. Okay, or in other words, we may be able to reduce the severity of infections for among those who have been vaccinated. And the vaccines are considered safe and efficient based on various studies. And please consult a doctor prior to vaccination if there are any doubts. Especially for kids, they will be consulted by a doctor before the vaccination to determine the suitability to take the vaccine.
Thank you, Doctor.
Thank you, Doctor. Okay. Thank you, Doctor.
Doctor, I can still hear my
Doctor,
voice
I can still hear my voice when I speak the echo. So what I'm going to do is
unmute you. And yeah, thank you so much, Doctor, that you can unmute when to speak. So thanks so much, Doctor, for your sharing. It's such an important topic at the moment now because as the adults are going for their boosters and also parents of younger children between 5 to 11, I'm one of them who are considering whether to get their kids vaccinated. Very happy that both my kids age 6 and 10 this year are vaccinated. So, and also I think the sharing, the presentation you have shown have actually give a lot of assurance. So we have a few questions for you from the registration form. So we have 5 questions here. I will ask the first question first. Doctor, do we know the long-term side effects of these vaccines? Will it not interfere with their reproduction? I heard that some women had their menstrual cycle affected.
Okay, so first of all, to comment about the long-term side effects, okay, the vaccine have been started last year, right, 2021. So we are still yet to have sufficient data to see the long-term side effects. That's number one. There have been incidences of menstrual cycle being affected. Whether or not it's directly related to the vaccination is still not determined, right? So there could be various reasons for such incidents to happen. And again, the number of incidents related to menstrual cycle is substantially much lower among those who have been vaccinated. There have been millions of people have been vaccinated, but this kind of effects are seen in a very low number of people. So again, there is no data showing it's related to the vaccine, and it could be, again, as I mentioned, related to many other causes, right? So it's advisable for women who have been affected to consult gynecologist, right, to investigate further. It may or may not be related to the vaccine. So as per the data available, there is no, it doesn't seem to have a data showing that it is related to the vaccine.
Okay, Doctor. The second question that I have. If the mRNA vaccine have been touted as safe, why have there been so many adverse effects and even death? Doctor, we need to unmute, please.
Okay, so talking about death again, so there have been many deaths happened, right, after vaccination, right? But based on data we have, based on postmortem reports, it is again not determined to be caused by the vaccine. Okay, yes, it may have been caused by other conditions which happened after vaccinations. Okay, but however, whether the vaccine has directly caused the death has not been determined, right? And there have been many adverse events, yes, after vaccination, but again, we have to look at the total number of people who have been vaccinated, the rate of such adverse events. Okay, as per the data which I've shown earlier, and there are many more data available, it proves that the number of adverse events are very, very low, substantially very low as compared to the those without any side effects, right? And number two, it's always benefits versus risk. But as just like any other vaccines, right? COVID vaccines have a lot of benefits as compared to the risk, right? Benefits in terms of curbing the pandemic, reducing the number of infection, reducing the complication among those who have been infected. So, in a way, overall, the COVID vaccination seems to be helpful all over the world, right? It seems to have reduced the, the severity of the illness. Yes, the number of COVID infection has been uh, increasing from time to time, right? However, the number of severe infection has reduced, and we see such trend even in Malaysia now. The number of infection is much higher even compared to last year, right? But those who have been admitted to ICU, those who have uh, developed complications or death has reduced substantially. So it's a question of benefit versus risk. Just like any other vaccine, COVID vaccination does have adverse events or side effects, but it seems to be substantially much lower, and it seems to be bringing a lot of benefit compared to the risk.
Yes, doctor. Thank you.
Thank you.
Doctor, do you know when
Doctor, do you know when will a kid
17
age 17
will get her turn for a
will
booster
get
shot?
her turn for a booster shot?
As of now, I'm not sure. We are waiting for the announcement from Ministry of Health.
Okay.
Okay.
So,
So,
okay, I'm just going to mute
okay,
Dr.
I'm just
Ramesh
going
for a
to
short
mute
while.
Dr.
Okay, my question is, after contacting COVID positive, how long are our body are free from the virus, and after the 5 days or 10 days quarantine period, can we still spread to another upon contact?
If you're talking about spreading to others, it's generally okay up till about as per current data, up till about 10 days, it's advisable for us to be under quarantine, okay, avoid any form of contacts. After 10 days, it seems to be less, not infectious. Okay, that means we might not be spreading the disease to others. That being said, if we do not develop uh, any other complications, okay, for example, someone has COVID without symptoms or very mild symptoms, which has recovered within the 10 days. They are free from symptoms. They may have symptoms like loss of smell, loss of taste, mild cough, which may prolong. However, symptoms such as fever, or any form of sore throat, flu, cough, if that has recovered, very likely we may not be infectious after 10 days, right? But those with complications, yes, up till the quarantine period, which may be prolonged even until 21 days or 30 days, yes, it's advisable that they do not have contact with anyone during that period.
So you're saying that it can
So you're saying that it
maybe
can
up to 10 days.
maybe up to 10 days.
What about doing
Yes,
a
up to
PCR
10
What about
test to
doing a
determine
PCR
the
test to
CT value?
determine the CT value?
Okay, the CT value, yes, it may be helpful, right? We can see that those who are at the initial stage of infection, they have a CT value of about 15, 16, right? Generally below 20. And after a period of about 1 week or 10 days, it may have increased to over 20 or 30 plus, right? So this is the trend we see. Okay, but the question is it important for us to do a PCR test to determine CT value, right? It's no. The answer is no. Okay, what we need to determine is these symptoms, the clinical uh, condition of the patient. Okay, as I've mentioned, if someone has recovered from the mild symptoms, fever, cough, or flu, right? Cough, yes, mild cough will be there, but the initial cough might be more severe, right? So if they have clinically recovered from this, yes, they are already free. And as I mentioned, they are no more infectious. They're considered no more infectious after the 10 days quarantine. Okay, therefore, it is not advisable to do a PCR test just to look at the CT value, right? it does not show us anything that whether this person is still infectious or not. Okay, more important, as I mentioned, it should be based on the symptoms. So if someone has a symptom after the 10 days period, they may have to check again. Usually we notice that their quarantine period will be prolonged by the Ministry of Health. Some of them have been quarantined up till 14 days, 21 days, if their symptoms seems to be not recovering so soon, right? So I wouldn't recommend doing a PCR test.
That's good to know.
That's good to know.
Because mostly what we felt is that some patients, they felt that they want to know that with the PCR test, it actually to determine whether they are free to meet up with their family members. So they have that fear, even though they don't have symptoms anymore. But it's good to know that Doctor mentioned that as long the patient don't have any more symptoms, then they are not infectious anymore. Okay, so we have the question for the registration form have all replied. Now we move on to the chat box. If any of our attendees today who have any question for Dr. Ramesh, feel free to put your question in the chat box. So our first question in the chat box is, so after 1st of April 2022, which is another 10 days time, no mandatory vaccination for all people, even for children? That's a question for doctor. Okay, doctor, you need to unmute, doctor.
Okay, so for children vaccination, it is until now not considered mandatory, right? There have never been a mandatory vaccination for kids as well as for adolescents, right? For adults, okay, after the 1st of April, those who have not taken the booster dose vaccine, that's for the group of people who have taken Sinovac first dose or second dose. The status in MySejahtera will change from fully vaccinated to partially vaccinated. This is what we know, right? And for those who have taken the Pfizer dose first and second dose, as far as I know, the status will remain as fully vaccinated. Okay, so the only group of people who will be affected after the 1st April are those who have taken Sinovac first dose and second dose and did not go for any booster. Right? Okay, so again, I wouldn't say even now at this point there's such a thing as mandatory vaccination. The government has always mentioned that vaccines are not mandatory, right? However, yes, there are restrictions for us to do certain activity, to go to certain place if we are not vaccinated, and that is really up to the public to choose.
So it's not mandatory, but
So it's not mandatory, but your
might be restricted.
might be restricted.
Okay. Doctor, next question.
Doctor, next question.
If a person don't have any
If
symptoms,
a person don't have any symptoms,
how will he or she
how
know
will
that
he
they're
or she
infected?
know that they're infected?
If you ask me, it's a very difficult thing. We would not know whether we are infected or not without symptoms, right? Though that's a reason the disease can spread, because many people do not have symptoms, and the only way we would test ourselves is when we have a contact with someone having COVID. So yes, we wouldn't know whether we're infected or not if there are no symptoms.
The only way is you do
The only way is you do a self-test.
Yes, maybe. Maybe, yeah, the answer is maybe, because the self-test seems to also have false negative findings, which means people have, even those having symptoms, they have a false negative. That means the self-test shows that it's negative for COVID, and then when they go into a PCR, it shows a positive, right? So difficult to comment.
Doctor, is it true?
Doctor, is it true if infected
with COVID-19, we can't eat or
drink sweet?
I'm not aware about that.
Okay, so I think the statement
is not true.
I'm going to mute doctor for a while. Okay, doctor, how does a person know when they have a sore throat, if it's due to COVID, or a normal sore throat if they don't do self-test? Are there any other symptoms to look out besides self-test?
Okay, we definitely have to do a self-test, right? Okay, when we have sore throat, we have to do a self-test, not just sore throat, any symptoms, cough, fever, or even if you have persistent headache, right? So when you have such symptoms, you have to do a self-test. There's no other way to know whether it's caused by COVID or not without doing a test. That's number one. But if you ask me, what are the other symptoms which are commonly felt by people with COVID? Loss of smell, loss of taste. This seems to be something unique to COVID infection, right? And yeah, apart from that, there's no other way we would know without doing a test.
But doctor, I heard that
Doctor,
Delta and Omicron,
Delta and Omicron,
the symptoms are very different.
the symptoms are very different.
It may be also similar, very difficult, right? Differs from case to case. So to me, based on what we have seen patients being admitted. We don't really do the genomic studies usually. Okay, that means we don't go and do the further test to determine the variants, right? Because it's quite expensive. Okay. However, general data, it's difficult to differentiate both of these based on symptoms.
A question from myself. Just now you mentioned that let's say a child took a Pfizer first dose, and if the parent is not comfortable to have the Pfizer second dose on the child, the parent can actually request to do Sinovac as the second dose for the child. So is that a second dose for the child, or the Sinovac cycle start over again? Okay, doctor, please unmute, doctor. Yeah.
Okay, it's not again. Let me correct it. Okay. It's not that parents can opt for a different vaccine as a second dose, right? That is not true, right? Parents cannot, I mean, if they have opted for Pfizer as a first dose, they cannot go and request for Sinovac as a second dose. Okay, that is definitely not allowed, even for adults or adolescents. Okay, so that means we have to decide before the first dose is taken. However, if the vaccinee, whether or not it's adults, adolescents, or kids, if they have developed side effects, allergic reactions, sorry, not side effects, allergic reactions to the first dose, that means after Pfizer, they have developed difficulty breathing, they have developed severe rashes, okay, or swelling of the eyes, right? So such allergic reactions, obviously we cannot give them the Pfizer again, right? So in such situations, the doctor will decide to start them on another type of vaccine. However, when we start on another type of vaccine, they will require a new cycle. That means they have to go for a first dose and second dose and so on, right? So that's what I meant.
Thank you very much.
Thank you very much. Very clear now.
Our last question
on the chat box.
What is the safe quarantine
period
for someone who has Omicron and recover from it to meet others? Okay, doctor, we need to
Okay. The first question is, how do we know whether we have Omicron or we have Delta? Okay, so again, it's very subjective. In private hospitals, it is only done when patients are really keen to know or they are willing to pay and do the further test, right? In KCAM, again, it is not usually done. Okay, we don't really want to differentiate what type of COVID. Okay, it's a study that's expensive, and also it takes time to determine, right? And whether or not it's necessary. Okay, unless we are collecting data, right? So if you ask me what's the safe quarantine period in Malaysia, it has been standardized. For any type of COVID vaccine, it has been standardized, right? So as of now, for those who are fully vaccinated, the quarantine period is 7 days. Fully vaccinated meaning that they have taken the booster as well. Those who are not fully vaccinated, that means those who have not taken their booster, the quarantine period is 10 days, right? So that is applicable to any type of COVID infection. Next one is.
All right, great.
All right.
Next one is, for those who have recovered from COVID, do they still advisable to go for second booster if it's available? Second booster.
Second booster. That means fourth dose.
Okay. I'm not able to comment this. We have not even started decided or started the fourth dose. Okay, it's still being studied. Yeah, I'm not able to comment on this.
Thank you so much, Doctor. Thank you so much for your time being with us here today. I really appreciate your knowledge on sharing. It has been very helpful to myself, and I'm sure all our participants that join us here today. Okay, so I would like to, is everybody able to see my screen? Yes, so here I have Dr. Ramesh as a profile, okay, and he's in Gleneagles, okay. And if you'd like to speak with him more, you can probably make an appointment to see him. But thank you so much, Dr. Ramesh, for sharing with us. Has been indeed very knowledgeable. Yes, Doctor.
All right. Thank you. Thank you for the opportunity to share and to discuss. Okay, so it's again also a learning opportunity for me from all of your questions, right? So as a final word, I would say I recommend all of you to go for the booster and also bring your kids for the kids vaccination. And if you are in doubt, yes, always clarify, always meet a pediatrician in advance. You may go for a consultation, or you may see a doctor to check, right? To get further advice before the vaccination, right? But it is definitely helpful to take a vaccine. Thank you.
Thank you, Doctor. Yes, definitely encourage everyone to go for the vaccination and booster, and also for their children. So go for it. So here is the feedback form. If you would like to put your comments to thank Dr. Ramesh, please scan our QR code to answer our feedback form. Give our feedback. Okay, what you've learned from today's talk and how you feel about our virtual talk all these months. Okay, and we will send your positive comments to our speakers. All right. If you have missed out this QR code, no worries. Our team will send to you after the talk today. So a huge thank you to Gleneagles Hospital Kuala Lumpur, especially our marketing team with Sarina for arranging wonderful, fantastic speakers in our monthly virtual talk. We have learned so much. Follow them on their social media in Facebook, in Instagram, and also LinkedIn. There are a lot of valuable information and also videos on their social media. So the Pioneers Financial Services are part of Prudential. We are partners with Prudential. So good news, Prudential is covering COVID-19 and all future pandemic in our medical plan, meaning that if any of our clients are admitted to our panel hospital due to COVID or future pandemic, Prudential medical plan will cover using the hospital and surgical benefit. So if you need more information, speak to any of us that invited you here today to get more info. Okay, our next health talk is on the 10th of April. It's also the second week of the Holy Ramadan month. So wishing our Muslim attendees and friends and clients who are in this talk today very good Selamat Puasa, okay, on the 3rd of April. So our next talk is going to be on a Sunday as well, 10th of April, Sunday, 3 o'clock. And the topic is coping with endometriosis and cervical cancer. Our speaker for next month is Dr. Abdul Aziz Yahya. So join us next month, register early to avoid missing out from this talk. So this is me. My name is Amy, your host today, and your host for the past almost 2 years. It has been a great pleasure of me hosting everyone on Sunday afternoon. I've learned so much, and also I've met many new friends through this virtual talk. So get connected with me in our social media. And here's the team. Okay, a fantastic team that has been helping me with co-hosting, okay, taking care of everyone to ensure that everybody can come in to this talk, all right, and everybody are able to hear and see clearly. So connect with us in our Facebook page. Okay, and our team is expanding that we are actually recruiting more financial advisors to join us. If you'd like to find out more, come and join us, all right, to know more about this career. Okay, we are also on YouTube. Many of our attendees constantly ask, do you have can you replay the talk that we have? Because it has been such fantastic information that they like to share with their loved ones, or they like to go back to listen again. Yes, we are on YouTube. So subscribe to us and join us. We will upload our next talk within a week after the session. Yeah. So that's it. Thank you so much once again for joining us here today. Have a fantastic rest of a Sunday, okay, and also rest of the month, because today is already mid-month of March. Yeah, give us your feedback and join us for next month. So stay safe, take good care, everyone. See you next month. Thank you so much, everyone. Thank you, Doctor. Thanks, Arina. Thanks, everyone.